You have been living with the burning agony of a herniated disc for months. You have finally accepted that physical therapy and pills are not working. You are considering a surgical intervention, but you are paralyzed by fear. You're lying awake at night asking yourself 3 terrifying questions that your local doctor refuses to answer clearly. Number 1, if a surgeon removes the hernia, will my spinal disc completely collapse and lose its height? Number 2, is there a massive risk that the hernia will simply explode out again next year? And number 3, if I try a minimally invasive laser treatment and it fails, what happens to me then? If you're asking these questions, your fear is entirely justified. You are trying to protect the structural integrity of your spine. Today, we are going to act as your medical guide. We will strip away the surgical jargon, look at the pure mechanical physics of the spine, and give you the honest, uncensored answers to what actually happens to your body after herniated disc surgery. Let us answer the most common mechanical question first. When a herniated disc is treated, does the disc lose its height, or does it only shrink at the site of the hernia? To answer this, you must think of your spinal disc like a heavy-duty, pressurized car tire. The hernia is a dangerous bubble forming on the side of that tire, pressing directly against the wall where your delicate spinal nerves live. If we use a technique like percutaneous laser disc decompression, we insert a microscopic laser fiber into the center of the tire. The laser evaporates a tiny amount of the water and tissue inside the disc. This drops the internal pressure, creating a vacuum effect that pulls the dangerous bubble back inside. So does the tire lose height? Yes, slightly. Because we have removed a small amount of volume from the center, the overall disc will flatten by a very small fraction of a millimeter. However, this microscopic loss of height is a biological trade-off. We gladly trade a fraction of a millimeter of disc height to instantly relieve the crushing, destructive pressure on your spinal nerve. The slight settling of the disc is completely safe, whereas leaving the nerve crushed will result in permanent leg paralysis. This brings us to the second massive fear, the risk of recurrence. Patients constantly ask us, when you remove the hernia, do you stitch, seal, or cauterize the hole in the outer wall of the disc so it doesn't happen again? This exposes a massive limitation in traditional open spine surgery. The outer wall of the disc is called the annulus fibrosus. In traditional open surgery, like a microdiscectomy, the surgeon cuts away the herniated fragment, but they are forced to leave a physical hole in that outer wall. There is no magical glue or stitch that can withstand the thousands of pounds of pressure your spine endures every day. Standard surgery leaves the door open, which is why traditional operations carry a significant risk of the hernia returning. However, minimally invasive procedures attempt to alter this biology. When we use the percutaneous laser disc decompression laser, the thermal energy from the laser does not just vaporize the center of the disc. The controlled heat actually alters the collagen fibers in the outer wall. It causes the torn fibers to shrink, contract, and scar together. While it is not a perfect, impenetrable seal, this thermal contraction acts as an internal biological weld, significantly reducing the size of the tear and lowering the risk of a secondary explosion compared to open surgery. But you must do your part. If you do not correct your posture, strengthen your core, and stop lifting heavy objects with a bent spine, the mechanical pressure will eventually tear the wall open again. But what if the laser is not enough? To answer this, we must perform a diagnostic masterclass. We cannot treat every herniated disc with the same tool. We must look at your high-definition magnetic resonance imaging scan to identify the exact stage of your disc failure. We are looking for the difference between a protrusion and an extrusion. In a protrusion, the outer wall of the disc is stretched and bubbling outward, but it is not completely broken. The gel is still contained inside. This is the perfect scenario for the percutaneous laser decompression. The vacuum effect works flawlessly here. But what if the MRI shows an extrusion or a sequestration? This means the outer wall has completely ruptured, like a burst dam. The toxic internal gel has violently exploded out into the spinal canal, and a massive fragment has physically broken off and is migrating down the spine. If a doctor tries to use a blind laser on a sequestered fragment, it will fail completely. The vacuum effect cannot pull back a piece of tissue that has already broken off. Applying the wrong tool to the wrong stage of herniation is why so many patients suffer from failed back surgeries. If your MRI reveals that your hernia is too large, fully extruded, or heavily calcified, we do not panic, and we do not instantly resort to fusing your spine with titanium screws. We simply escalate our protocol to the next minimally invasive step, transforaminal endoscopic discectomy. Instead of using a blind laser, we use a high-definition camera. Through a tiny incision no wider than a pen, we guide an endoscope directly through the natural openings in the side of your spine. We do not cut your heavy back muscles, and we do not destroy your bone. Looking at a massive surgical monitor, the neurosurgeon can visually identify the exact broken fragment of the disc that is crushing your nerve. Using microscopic instruments, we gently reach in, grab the toxic fragment, and physically pull it out of your body. We clear the canal and instantly free the trapped electrical cable. We preserve the rest of the healthy disc, and the patient usually walks out of the clinic the exact same day. Many patients live in chronic agony because they are paralyzed by the fear of surgery, or they blindly accept whatever generic procedure their local hospital offers. But let us look at the true cost of getting this wrong. If you allow a local surgeon to perform a massive open laminectomy when you only needed a 15-minute laser procedure, you are guaranteeing yourself months of agonizing recovery and massive scar tissue. Conversely, if a clinic tries to sell you an expensive laser treatment for a massively sequestered disc, the procedure will fail. You will lose your money, and the nerve in your leg will eventually die from oxygen starvation. You are risking permanent neurological damage because your doctor did not match the surgical tool to your specific MRI. For a fraction of the cost of a failed surgery, you can have an elite neurosurgeon review your imaging, potentially saving you from a catastrophic medical mistake. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution to your pain. But you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comment section. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, measure the exact stage of your herniation, and build your personalized, minimally invasive treatment plan. Stop living in fear of your diagnosis and stop treating the wrong anatomy. Let us find your solution today.